All right. Well, welcome everyone. Thank you so much for joining us. My name is Savina Chacheva. I'm the program director at the Cancer Wellness Center. For those of you new to the Cancer Wellness Center, I'd like to take a minute to tell you more about the center and the services that we offer here. We're a nonprofit organization aimed to improve the physical and emotional well-being of those impacted by cancer and their families. Our services, which are currently both virtual and in person, include education programs like the one this evening, that are developed to help you navigate the varied challenges that come with living with a cancer diagnosis, wellness classes like yoga, meditation, Tai Chi, stress reduction, and more that provide a holistic approach to healthy living, and support services, including counseling and support groups that are designed to help patients and their loved ones, as well as those bereaved, manage the mental and emotional impact of cancer. If you would like to learn more about the center and connect to the free programs and services, please visit cancerwellness.org, and I'll include the link in the chat. Please note that this program is recorded. Your audio will be disabled for the beginning of the presentation. If you have questions throughout the program, please type them into the chat and we'll get to them at the Q&A session. You also have the ability to unmute at the end once the recording is turned off. Now, without further ado, I would like to welcome my collaborative partner here, Kim Jensen from Northwest Community, who will introduce our speakers. Welcome, Kim.
Thank you, Savina. I'm glad to be partnering with Cancer Wellness Center. I am the oncology social worker for outpatient at Northwest Community Hospital, and I am happy to tell you about our programs as well. You do not have to be a patient of Northwest Community Hospital to participate in our support groups. So if you are interested in our support groups, as well as the North Shore support groups, you can go to our website, nch.org, and the North Shore website to find cancer support groups that you may be interested in at their organization as well. We're all one organization now. We have been for over a year, and it's great that we can partner together. With that, I'm going to introduce our speakers. We're lucky to have two speakers tonight. Dr. Carolyn Kirshner, who is from North Shore, who is a gynecologic oncologist. She is passionate about women's health and currently specializes in care of the female cancer survivor. She works with patients during and after cancer treatment to help them have the best quality of life for as long as possible, dealing with issues like menopause, nutrition, stress, and sleep. She is a yoga teacher and serves as a mentor for an organization called Y4C, whose goal is to make yoga accessible to everyone touched by cancer. Carolyn is privileged to have 4 grown children and 4 grandchildren so far. I would also then just like to introduce Heidi, and she will go after Dr. Kirshner is done. Heidi Wiltsey is the breast program manager and breast navigator at Northwest Community Hospital. She graduated from the University of Michigan of Nursing with her BSN. She's been an oncology nurse for 29 years, working inpatient, outpatient chemotherapy as an infusion nurse, oncology research, and as a nurse navigator. She has her OCN and her ONN-CG certifications. She is able to use all of her experience over the 30 years to care for our breast cancer patients at Northwest and their families as a nurse navigator. Working with cancer patients is her true passion, and she's blessed and grateful to do what she does every day. So thank you to both of you for speaking tonight, and I'm going to turn the program over to you. Dr. Kirshner.
Thank you so much, and it's wonderful to be here, and it is our privilege to be able to serve you in this way, and I hope that you find the program helpful, and it is a great privilege to work with cancer survivors. So I will share my screen. I have some slides. And we will go from here. Our title today is Menopause, or my title is Menopause and Cancer. As was mentioned, I'm a gynecologic oncologist at North Shore University Health System. So our goals for the evening are to discuss reasons for early menopause in the context of cancer, common symptoms of menopause, hidden consequences, of menopause and how to prevent them. And then the next part will be on how to deal with consequences of early menopause as far as symptoms are concerned. So what exactly is menopause? The average age of natural menopause in the US is 51. And this is a little bit dependent on heredity. So if you can look to your mom maybe, and that may give you some guidance as to what your natural menopause would be. If you have early menopause, that's defined as yet less than age 45, but premature menopause is younger than age 40, and we even see younger than that. The natural menopause, spontaneous menopause, is gradual, so that your ovaries gradually stop producing hormones. So it is just over a period of years. But surgical menopause, where you have your ovaries removed, is very abrupt, and that is the most sudden. The biggest shock to your system is surgical menopause. And menopause is defined as no period for 1 year if you haven't been on chemo or tamoxifen, because we know some people who are on chemo or hormones will get their periods back after they finish up their treatment. Or menopause is no menses after the surgical removal of the ovaries. So again, that occurs immediately. So what are the reasons for early menopause? That can be something that is, again, hereditary, primary ovarian failure, could be an autoimmune disorder, but it could be as a result of chemotherapy. It may not be permanent, but many women will lose their ovarian function temporarily during chemotherapy. Radiation to the pelvis, and this is usually permanent. It very rarely would ovarian function resume after you've had a certain dose of radiation to the pelvis. And the surgical removal of ovaries, then you would not expect your period to come back after that. If the ovaries are removed, then that is quote unquote instant menopause. If we're talking about chemo-induced amenorrhea, so it's in the literature, it's in studies as called CIA. That just means loss of periods related to having been given chemo as a part of your cancer treatment. And we found that people who get taxane regimens, so that's either Taxol, or you may call it paclitaxel, or Taxotere, these treatments plus hormonal treatments are most frequently associated with the loss of the menstrual cycle. And we found that the older you are when you undergo the treatment, the more likely it is that you will not get your periods back again after you finish your treatment. And so the risk of losing your periods permanently under age 40 is anywhere from 20 to 70%, and 50 to 100% over age 40. So this is really significant. And so this is something to consider with your oncologist, with your healthcare professional, when you're talking about your treatment. How is that going to affect your menstrual cycle? We do there is some data showing that if you do lose your period during your cancer treatment, and you have a hormone positive tumor that's estrogen receptor positive, that you may have a better prognosis if you lose your period. So it's kind of the silver lining effect. But what are the effects of early menopause? Vasomotor symptoms, that's the hot flashes or the night sweats. And that can occur any time of day. Disturbances in your sleep. There may be an increase in risk of cardiovascular disease, heart problems, and stroke. And early menopause may affect your bones, making your bones more brittle or more susceptible to fractures. The There can be changes related to your ability to think, dementia, Parkinson's disease. There can be more depression and anxiety as a result of menopause. And there may be changes in your, what we call the urogenital tract, your bladder, your vagina, which may result in urinary incontinence and vaginal atrophy, which is a thinning of the vaginal area. And also infertility. If you're not having periods, then you are not able to get pregnant. And so this is definitely something that is going to impact a younger person. So how do we define infertility? It's the inability to start or continue a pregnancy. So the ovaries no longer contain healthy eggs. There can be damage to your sexual organs, which prevent implantation of a pregnancy. The damage may prevent the body from being able to carry a pregnancy. And the risk of infertility depends on the type of chemotherapy, how long you have your treatment, the dose of your treatment, can depend on the type of surgery you have, whether the entire ovary is removed or just part of an ovary, radiation, and this would be to the pelvis more so than to the breast. Generally, the pelvic area is shielded during radiation to the breast. But other factors like age and was there a fertility problem even before the cancer diagnosis? You can do some fairly simple lab work if you're not sure, you've gone through your treatment and you're not sure, am I in menopause or not? You draw an estrogen level and another hormone level, and these can be very helpful in determining what type of treatment you would have from there, and also what to expect as far as your period goes in the future. So 80% of all women experience hot flashes during menopause, and the symptoms last longer than you would think. They can last years. Sadly, my mother, who is 91, still gets hot flashes. So what does that say for me? Nothing very good. But typically it's 4 to 5 hot flashes per day. There can be the metabolic changes, increase in abdominal fat, increase in cholesterol, increased risk of heart or stroke issues. Menopause can even affect your muscle and your muscle health, accelerated aging. I mentioned that you can lose some of your bone mass, but you can also have joint pain. You can also have a loss of muscle mass, and that can be an increase in body fat. Cognitive function, difficulty concentrating, depression, anxiety, and some sleep disturbances. And if you're not sleeping well, it's pretty hard to continue to think and process things well. The genital urinary syndrome of menopause includes vaginal dryness. So this means pain when you have intercourse. It can mean a loss of interest in sex. It can mean urinary issues, having to go to the bathroom frequently, a little bit of incontinence, maybe as you're trying to get to the bathroom if your bladder is a little full. And this can affect your quality of life, your partner relationship, and of course, your self-esteem. So now Heidi will take over from here and talk about all this doom and gloom. Now, what can we do about these issues?
Heidi, you're muted.
Thank you.
Mhm.
All right. So I don't know what I just did here. All right. So just to kind of follow a little bit of this is just kind of reiteration of what Dr. Kirshner said as far as what menopause is. So, I'm not really going to go over this too much, but I think the key factor takeaway is that it can affect your quality of life in a very negative way. And sometimes people who are going through cancer therapy, this is one of the most distressing, difficult pieces of their treatment, because you're far more than a cancer or a cancer patient. You're a human being. You're, a partner, a wife, a mother, all of these things. And, many of the symptoms and side effects that Dr. Kirshner spoke of can definitely have an impact on your world and your life. So here again is just kind of a repeat. So I'm not going to spend too much time on all of that. Again, the symptoms, and some people may have all of them. Some people may have 1 to 2. Some people may have, minimum, but it's important that we address all of them. And some of these issues may be difficult for you to bring up to a healthcare provider. But just know that you're always safe, whether it's with your doctor, or if you have a nurse navigator, whomever it might be, social worker, anyone like that. I think it's very important because our goal is to treat you whole as a whole person and make sure that you're functioning, well, all of you, not just focused on your cancer treatment. Part of what causes this is, the loss of estrogen and what it causes. And again, to speak to the vaginal dryness, I know that there's 2 ways to kind of work on this and treat this. And the moisturizer, which could be, vitamin E, there's a Replens tube that you can get, other things, but it's important to know that moisturizers are used for vaginal dryness as a maintenance. So that's something you want to do on a consistent basis. And a lubricant would be something that you would use, at the time of intercourse, so that it's more comfortable and it takes away some of that dryness. Other things, as far as how it can affect your relationships, I think the key factor is communication, and not only with your healthcare provider, but also with your partner, and just share what you're feeling, share your fears, share your concerns, so that you're on the same page and that it is something that you can talk about because it is part of your relationship. So let's see how tech savvy I am. I've got a quick video that I want to share. So I'm going to now I've got to go to, where did that share video thing go?
So if you come back to our Zoom screen.
Oh, there we go. Okay, there we go.
Perfect.
Can we see? All right, so let's hope we can all hear.
So I was diagnosed about 3, almost 4 years ago, and I had chemotherapy, which caused my ovaries shut down. I went into menopause at 23. I guess some of the popular symptoms, which I also experienced myself, is just low sex drive and discomfort during sex, and your period stops. So that was the only good part.
So I can relate to a lot of those symptoms, especially the dryness. Being married in a dry vagina is not fun.
I think a lot of women are surprised. At age 29 or 32, you're not thinking about menopause. Amenorrhea is the absence of having a menstrual cycle. And premature menopause happens in especially young women going through chemotherapy. There are certain chemotherapy agents that will increase the risk of losing their ovarian function or not being able to have periods any longer. And the highest offenders are usually the alkali agents, which are pretty common in breast cancer treatment.
The hot flashes, I think that they're worse at night. And I sleep with a fan on my face, and my husband has like 4 blankets on.
and I'm sweating my, hats off.
For me, it was a little bit different because I have the BRCA2 gene, so I'm positive for that, which forced me to get an oophorectomy. So I have everything. I have the hot flashes, I have the vaginal dryness, anxiety, I get like the panic attacks. The symptoms of premature menopause and natural menopause are the same. The difference is a patient who's young and we force into menopause, the symptoms can be more severe.
So guys, when did the menopausal symptoms finally go away for you?
So if I think back, I mean, it's really only been almost 2 years. There are times that I still experience the hot flashes, which is why I keep popsicles on hand.
So mine, I had menopause induced with the chemo and that was about 6 months. As soon as the chemo was over, my periods came back and I started to feel better. And then for the last 3 months, I've been on ovarian suppression, where I give myself a monthly injection to prevent ovarian function. And that will be for 5 years at the minimum.
The proportion of patients who undergo an irreversible menopause is not entirely clear these days. A lot of our studies looked at older agents as far as chemotherapy is concerned, and showed anywhere between 20 to 30% would have a permanent amenorrhea. But the complicating thing is the recovery of the ovary function can happen anywhere between 6 months to almost 2 years. Our newer agents, though, we're still unclear as to what impact they have on the ovaries. Age is a huge risk factor for permanent ovarian failure. The closer one is to a perimenopausal age, so over 40, the more likely the loss of ovarian function permanently will occur.
My oncologist set me up for an appointment with his nurse practitioner before I started chemo. And she's kind of the one who told me what to be prepared for. Then my oncologist sent me to a sex doctor. She's a GYN who kind of specializes in menopausal type issues. My oncologist just mentioned a lot of the symptoms with chemotherapy, like hair loss, fatigue, things like that. He very briefly mentioned the ovaries shutting down, but I mean, that's awesome that you got to see therapists and things like that and had that support. But I wasn't even aware that those things were available, and I can seek help on that.
So my doctor probably told me some symptoms and some things, but I think I was kind of at a place of still processing the fact that I was getting rid of these toxins going through my body. So she probably told me, and I just really wasn't listening.
The major thing about menopausal management is that it's serious, and that doctors like me need to take it out seriously and provide some guidance. And patients also need to bring it up as a concern, because if it's distressing, then it's something that we need to help relieve.
So did you ladies have hot flashes? Like, how did you deal with the symptoms? I tried to take control over some of the things that I could take control of, not overdressing for an occasion. So I always wear usually like a light tank top or a short sleeve shirt underneath everything that I could take off. Also, just not being embarrassed about it, not denying it, just saying, okay, I'm having a hot flash. Who's got a fan? Let's go.
So I did start yoga to kind of help me relax, not be as anxious and have anxiety. So I've been doing that, and I did schedule for like acupuncture and massage therapy as well.
So I've seen commercials and I'd heard about vaginal dryness, but I guess until you really experience it, you really just don't know. So my husband was very patient, and I'm certain at times he probably thought I was faking. I may have been, don't tell him. So I didn't really want to try like those potions and creams and things of that nature. So I actually used coconut oil, and it worked. I was completely surprised.
Simple things can be done to help menopausal type symptoms. Physical activity appears to be the panacea for poor quality of life, and that can certainly help. There are medications that can help with menopause, from gabapentin to some of our antidepressants. They have the added benefit of reducing the symptoms of menopause, especially the vasomotor symptoms or hot flashes. For women who don't want to take medications, complementary therapies can be of use, such as acupuncture, such as hypnotherapy.
So at 27, 4 years out of treatment, I'm really fortunate to say that I think I'm back to my normal self, or what is my new normal. My sex drive is back. The vaginal dryness has decreased significantly. I don't think it has gone away entirely, but it's getting there. It's getting better. I'm 35. My menopause is here to stay, with ovarian suppression most likely. So, you learn to deal with these things. Over time, you find a strategy that works for you, and just coming up with a game plan has really helped me.
Okay. So thank you for your patience with that. I have to give credit to Living Beyond Breast Cancer, which is a nonprofit organization that I work with, as well as am part of their survivorship series. I will be teaching 4 classes that I'll kind of talk about that at the end, but thanks to them for that video, for sharing. I think sometimes it's nice to know you're not alone and you can hear somebody else talk about what you're going through or what you might be going through. So as far as complementary therapies for early menopause, it's really all about the whole person. It's that holistic, physical, mental, spiritual interventions. But these also go along with everything that your physician is recommending in the standard treatment of care for you. So I think it's important that you remember that you always talk with your doctor before you start anything, because, everyone is individual, and, cancer treatment is one size fits one. So whatever works for you is what works for you. So it's important to stay in, constant communication if you're going to try anything. So here's just a couple complementary things, and then I'm going to go through each of them, as far as exercise, aromatherapy, acupuncture, relaxation, hypnosis, and cognitive behavioral therapy. So research has showed that exercise, as that physician said, it's kind of the panacea for everything, not just menopause. I think, life in general, but it just really increases your overall strength, fitness, wellness, mind, body, spirit. With the menopause, it can, kind of give you a little bit more, increase that bone density and decrease your risk of osteoporosis or osteopenias, and just kind of overall, helps you on every levels, can decrease depression, anxiety, and really just kind of increase your quality of life. The goal for exercise, that too is individual. We do hear that 30 minutes of exercise 5 times a week, 150 minutes a week. But if you're having the joint pain, if you're having weight gain, if you're having certain things and you can't start there, just so long as you start somewhere and you make it happen. So keep it safe, take it slow, and do what works for you. If your friend thinks that going to spin class and cycling is the be all end all, but you really like to swim, do what makes you happy and do what makes you feel good, because that's what's going to make a difference. Because if you find something you can stick with, that's exactly what's going to happen, is you're going to stick with it and you're going to get the most benefit possible. So being that Dr. Kirshner is a yoga instructor, I'm probably not the one that should be talking about this, but in my studies and in my, learning and whatnot, I have heard and learned that there are certain yoga poses that definitely do make a difference and can help with certain things. So I just want to share a couple of those poses with you. The one thing I want you to remember, and Dr. Kirshner, please, if I'm saying something wrong, just jump in and say, you have no idea what you're talking about. But The one thing I did learn is that yoga is symmetrical. So you want to make sure that you do both sides. So if you do it one way, then you go and you do it the other side. So one of the poses is Warrior Two, and it increases your circulation and builds your strength. And they encourage you to hold it for 20 to 30 seconds and then, repeat it on the other side. And that, I believe, is something what it looks like. Another pose that can help with hot flashes is the reclining bound angle. And it looks like you require a couple pillows or whatever, but you need to rest in this position and breathe and hold it for at least 1 minute, which I think looks phenomenal. I think we all need to do that, whether we're going through menopause or not. This one, sometimes with menopause, if you are having periods and having cramping and whatever, as far as heavy bleeding, the seated wide angle pose can increase circulation and build strength. And they say to hold it for 1 minute or longer. So I've seen this, and then I've seen it also where you lean forward and kind of put your forehead to the ground and your arms forward if possible. And this one I actually know works because I have actually tried it to help with your sleep and going to bed and falling asleep faster is the legs up wall pose. It's calming. It is supposed to promote sleep and you can hold it for 3 to 5 minutes. A couple other things as far as, bedtime rituals. I think as far as sleeping well, I think it's very important that you do have some sort of a ritual and you kind of take your evening to wind down and you have a regular kind of evening wind down relaxation time. Avoid caffeine and alcohol in the afternoon and the evening because those can definitely disrupt with your sleep. One that's supposed to help decrease anxiety is the reclining twist pose, increasing, blood to the kidneys and the adrenal glands, which can be taxed out when they're hit with stress. And then again, you would do that on the other side as well. As far as nutritional supplements and sometimes whether it's an herbal or vitamin or some mineral something, as far as that, I would say you need to doc with your doctor because there are so many things out on the market and there are so many things that people are claiming, but it's really not FDA approved and regulated. So definitely, if you're thinking about any supplements or trying any nutritional aids to help with your symptom management, always talk with your doctor about that. One thing that I think is wonderful for a lot of reasons is aromatherapy and the use of essential oils to help with, your mind, your mood, your everything. And they're normally being essential oils. A lot of them are organic. There are definitely some out there that are not, but they're extracted from flowers, stems, barks, roots, anything. And there's a lot of different ways that you can use these. Some people have a diffuser. Some people can put the oil in a bath and it can be inhaled. It can be put on your skin. There are a lot of products out there, Epsom salts that have essential oils in them. There are little roller balls that you can use on your temples for headaches or certain things like that. But obviously with anything, be careful when you're putting anything on your skin or inhaling something, or, some people say they'll even put it in their water when they drink. That be very careful with because there are definitely specifications with that. Definitely be drinking out of a glass water bottle and make sure it is pure and approved for ingestion. Studies show that it can help with anxiety, depression, help you sleep. And again, it's not FDA regulated, so it's something that you need to be careful with. And Talk it over with your doctor. Here are just a couple different oils and scents that definitely have an effect. And these are kind of the effects that they are claiming, that lavender can help with relaxation and sleep. Lemon can work with energy and elevate mood. Orange can work with relaxation and mood as well. I spelled eucalyptus wrong, so I'm very apologetic of that, but cooling and can affect the mood. Peppermint can help with headaches and nausea, and tea tree can help with your immune system. Many of these essential oils can also be found in teas that people tend to drink, and they can have the same effect on helping you through some symptoms. Acupuncture is something that is been around for a very, very long time, and be mindful of where you're going and who the provider is who does this, and make sure that they are a certified therapist to provide acupuncture. And what it does is it stimulates certain pressure points on certain parts of your body. And yes, it is using these very thin, flexible steel needles. And it's a very, very small gauge, but they insert those needles at certain points to help with these menopausal side effects. One thing, if you are a breast cancer patient and you have had, whether it's sentinel nodes or an axillary lymph node dissection, definitely be careful of that side of your body as far as where you had the lymph nodes removed. As far as relaxation, there's a lot of things we can do to kind of relax and control our thinking and focus our mind on healthy and healing and, peaceful, calm atmospheres. Oftentimes anxiety is one of the triggers to hot flashes. So people will tend to notice that when they're feeling a little more anxious and struggling a little bit more, they may have more hot flashes. So the goal is obviously to avoid those triggers. So there are definitely a bunch of apps that you can try. Some of them, there's a cost, some of them are free. It really depends, but here's just a few of them that are available out there. And one thing that's been known to help people kind of manage and get through their hot flashes is to keep a journal or keep kind of a log of, when you're having them, what time of day is it? How hydrated are you? How much sleep have you had? Any certain foods that you've eaten recently, or your activity level, or certain things like that. But sometimes if we can find those triggers and we can keep a log and pay attention to when and why they're happening, it can be helpful in avoiding them. As far as hypnosis, I don't know of, and I haven't learned a whole lot about its effects and how it can help. There's very limited research in how that can affect your hot flashes or other menopausal symptoms. So there's no kind of gold standard as far as what to use and what to do when it comes to hypnosis. Cognitive behavioral therapy, there's many, many options out there, whether it's a support group, whether it's meeting with a counselor, a social worker, something along those lines. There's definitely different types of cognitive therapy that can be done. So open your mind, and, there's definitely things out there, and they can focus on you really caring for yourself. And I think that's the biggest thing is with the cognitive therapy, is that you can really gain some control and really better take care of yourself. And I think that's important when it comes to especially dealing with cancer therapy, is that once you receive that cancer diagnosis, sometimes there's that loss of control. It's what is there that I can do to help? What can I do to make it better? And with the cognitive behavioral therapy, that definitely opens up some doors and options to help you help yourself. Other treatments that are not, again, regulated, but they're out there that I'm sure people have heard about is CBD, that can be in oils, tinctures, certain things. Obviously, there's no clinical FDA approval as far as consistency of how things are processed all the time. There is also medical marijuana that is legal in 36 states, along with Washington, D.C. Again, definitely something you need to speak with your practitioners about, because you want to be safe, because we don't want to harm you more than help you. So as far as summary, breast cancer treatment or any cancer treatment in that manner, and I apologize that I kind of lean to breast, but that's my background and where I'm at right now. But it can definitely have a permanent or temporary effect on your life and your menopausal status. And if you are in the younger generation who is going into menopause early, when there's still a discussion of, do I want to have a family? That is definitely something to talk with your physician about as well, to discuss fertility options prior to and post any cancer treatments that you can have. And then I just, kind of shared some of the places where I refer my patients to, or that I've used in the past, the American Cancer Society, breastcancer.org, and as I said before, Living Beyond Breast Cancer. They're a really great nonprofit organization, and they have multiple classes and retreats and certain things. They have educational seminars, as well as materials that, really do help patients that are going through, cancer treatment. And I apologize, I was doing work before I logged on, so pardon my screen there. But, if you have any questions, obviously you can reach out. And as I said, I'm going to stay in touch with Savina and Dr. Kirshner and Kim about the 4 classes that are going to be offered throughout the NCH North Shore Edwards Elmhurst Health System for the 4 classes that are going to be taught. One of them is early menopause. The other one is long-term late effects of cancer treatment. There's one on sex and intimacy, and there's also one on self-care. So more to come on that. And then I just kind of shared my resources. So thank you for listening, and I hope it was helpful. And back to you, Dr. Kirshner.
Thank you, Heidi. And I would say I am in such agreement with everything that you said. And I am a big proponent of yoga, and I think all yoga. And to put in a plug for the Cancer Wellness Center, we do have both online and in-person classes. So I would encourage you to check that out, and it's available for anyone. We are nonpartisan, so we want to really serve everybody, not just North Shore, not just Northwest community. So please take advantage of all that is available. So I wanted to just take a moment to now talk about some of the more medical treatments, which actually really overlap quite a lot with the non-medical treatments. And that's definitely my bent as well, to go with non-medical treatments as much as possible. But there are fertility preservation options. Heidi touched on this, but just to know that if you are undergoing a treatment that may affect your ovaries, consider seeing a specialist, a fertility specialist, before you start treatment. They are very in tune to getting you in as soon as possible. But you can freeze embryos, you can freeze your oocytes, your eggs, you can do ovarian shielding in the case of radiation. If you're having surgery, you can move the ovaries out of a field that might be radiated. There's fertility sparing surgery, there's freezing of ovarian tissue, and there's ovarian suppression during chemo, which shuts down the ovaries to make them less susceptible to chemo while you're receiving it. So see a fertility specialist if you're concerned about future fertility, and I would just say the sooner the better. So Heidi touched on some of these. The acupuncture actually is evidence-based, so I'd encourage you to think about that. Exercise, if there is one thing that I would tell any cancer survivor, and actually any human, it's to move. Get more movement. You don't have to run a marathon, but do something to increase your heart rate, to improve your cardiovascular system. And also remember flexibility, so something like yoga for flexibility and strength. Some free weights can be helpful. Just find something that you love to do and do that. Maintaining a healthy weight. People who are overweight tend to have more hot flashes. So that's another reason to try to get to a normal weight, or a healthy weight, I should say. Heidi mentioned cognitive behavioral therapy and yoga, which I love. Look at triggers, and she talked about a journal for when you have hot flashes. There are things that are known to trigger hot flashes. Red wine is probably the biggest, but any alcohol, stress, fatigue. So if you're tired, if you're under stress, you're going to have more hot flashes. So that's something to think about. If you find that you're having a lot of hot flashes during sleep, there is this pad available online, which you push a button and it makes you lie on it. It goes under your bed sheet, your mattress pad, your mattress. No, not underneath your mattress cover. And you push a button, it gets cold, and then you push a button and it gets warm again. So that's an option besides running out of the room and throwing open the window in the middle of January. But there is also a surgical procedure, and it's done by a doctor down at Northwestern called stellate ganglion block. And this would be obviously for severe refractory hot flashes, where he does this injection in the neck behind your big vessel. So there are options. There are medications, which was mentioned in the video. The most effective is to take estrogen, but if you have an estrogen dependent tumor, you cannot have estrogen. But if you're not a breast cancer survivor, if you have a different type of cancer, estrogen could be an option. I'm not a huge fan, but there are other options. Effexor, paroxetine, escitalopram, these are antidepressants. And then there are various options. I do prescribe these as a kind of almost a last resort. I really try to go with natural methods if at all possible. So going on to the metabolic effects of menopause, which is the increased risk of cardiovascular problems, weight gain. So try to maintain a healthy weight, stay active, do several different types of exercise, the aerobic, do something to maintain muscle mass, do something to help you relax. Make sure you're getting enough sleep. People who don't sleep well tend to be at risk of gaining weight. And why? Because if you're not getting enough sleep, your stress hormone levels go up in your body, and this causes your body to pour glucose or sugar into your bloodstream. That's what the stress hormones do. And then they sit there in your bloodstream, and then your body says, oh, there's too much sugar in the blood, and it puts the sugar into fat. So we know that sleeping well, 7 to 9 hours a night, it sounds like a lot, but really try to do that. And that'll put less stress on your heart, your kidneys, and your brain. We also know that a plant-based diet, and we could have a whole huge lecture series on nutrition, but consider what you eat. Veggies are great, whole grains are great, healthy fats, avocados, nuts. Limit processed foods. You don't have to be, eat totally organic, but limit those processed foods like hot dogs and lunch meat and bacon and salami. Protect your bones. So you can actually do a test. There's a tiny bit of radiation, but it's actually the easiest test you can get, called a DEXA scan, which is a screen for osteoporosis. And if your bones are starting to lose calcium, get more calcium in your diet. That's far better than taking supplements. Vitamin D is also really important for bone health, and most Chicagoans in the winter need a supplement. In the summer, it's not so much a problem, but in the winter it is. So taking 1,000 international units per day for most people would be a good idea. And then weight-bearing exercise. So you give your bones a little bit of stress to help them to remodel in a healthy way. So weight-bearing exercises, walking, it's yoga, it's free weights, it's jogging. So there are so many things just that are going to put a low level of stress on your bones to help them to stay strong. Skin and hair is also affected by menopause, but a lot of times people past menopause or in menopause may have low thyroid. So consider getting just a very simple blood test to check your thyroid. Supplements for your skin and hair include biotin and zinc. There's a little foam that you can put in your hair, minoxidil foam. And there is actually a diuretic that may be helpful, and that would require a prescription. We touched a little bit about the cognitive effects of menopause, that we seem to have this brain fog. And again, sleep, so important for allowing us to process things in our brain, allowing us to function at our highest level. So get enough sleep, use mnemonic devices to help you, or make lists if you need some help with cognitive function. And then again, physical activity there's a recent article talking about chemo brain and saying that the best thing that you can do to battle chemo brain is exercise. So there we have it again. If you don't remember anything from this presentation, remember that get up and move. That's going to be the best thing that you can do for yourself. Sex drive. We know that interest in sex occurs in most postmenopausal women. Heidi mentioned important to communicate with your partner. There are ways of treating the pain and discomfort, but it may be that you need to see a counselor. There are sex therapists available, or maybe just marriage counseling. Medical treatments, testosterone, I'm not a big fan. There are non-hormonal options, but so far, most of them are available for premenopausal women only, which doesn't really apply to this talk. They are coming for postmenopausal women, but they're not all that they're cracked up to be, let's just say. But there are, Heidi talked about the vaginal moisturizers. One of the women said coconut oil. Hey, what could be better than that? Replens, Uberlube, hyaluronic acid. Those are the moisturizers, but then the lubricants for sexual activity. You can use, if you had a port and you have that little lidocaine that you put on your port before it was used, you can actually use that down there 10 minutes prior to sexual activity to numb any area of little focal area that may be painful. Dilators can be used. There's pelvic physical therapy. The vaginal laser was hot. It's kind of gone out of favor a little bit more, but I talk to people about that. Sometimes local estrogen treatment can be used, even if you have a history of an estrogen receptor positive cancer. And then vaginal androgen is up and coming. So my conclusion: sleep, eat well, stay active, work on your stress management, yoga, and mindfulness. So yes, I am a doctor, but I'm still really into the natural ways of being healthy rather than going straight to medication. And thank you so much for your attention. I will, I think, give it back to Savina at this point, maybe.
Thank you so much, Dr. Kirschner. I will actually turf it over to